بسم الله الحمد لله والصلاة والسلام على رسول الله رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي السلام عليكم ورحمة الله وبركاته. In the video today, I'm going to talk about bipolar disorder. This is something that many people do get confused about, and they kind of use it to describe different mental illnesses. So I think it would be helpful, inshallah, to kind of define what it is and how we treat it. So what is bipolar disorder? Well, essentially, it's also called manic depression, and it's a mental health condition that causes extreme mood swings, including emotional highs, which we call hypomania or mania, and lows, which we call depression. So when you become depressed, you may feel sad, hopeless, or lose interest or pleasure in most activities. And then when your mood shifts to mania, or to hypomania, which is the less extreme version, you may feel euphoric, full of energy, or unusually irritable. And these mood swings can affect your sleep, your energy, your activity, your judgment, your behavior, and to the ability to think clearly. So the episodes of mood swings may occur rarely or multiple times per year. While most people will experience some emotional symptoms between episodes, some may not experience any. And although bipolar disorder is a lifelong condition, you can manage your mood swings and other symptoms by following a treatment plan and reducing the impact it has on your life. And in most cases, bipolar disorder is treated with medications and talking or psychological therapies, which inshallah I will define later on. So, what about the symptoms? Well, there are several types of bipolar and related disorders. These may include mania or hypomania and depression. Symptoms can cause unpredictable changes in mood and behavior, resulting in significant distress and difficulty in life. So, bipolar 1 disorder, this is where patients have had at least one manic episode that may be preceded or followed by hypomanic or major depressive episodes. In some cases, mania may trigger a break from reality, such as what we call psychosis. Bipolar 2 disorder is where a patient has had at least one major depressive episode and at least one hypomanic episode, but you've never had a manic episode. So that's the difference. In bipolar 2, you have a hypomanic rather than a manic episode. We also have something called cyclothymic disorder, where patients have had at least 2 years or 1 year in children and teenagers of many periods of hypomania symptoms and periods of depressive symptoms, though less severe than major depression. Then other types, for example, bipolar and related disorders, which are induced by certain drugs or alcohol or due to medical conditions such as Cushing's disease, multiple sclerosis, or stroke. So bipolar 2 disorder is not a milder form of bipolar 1 disorder, but a separate diagnosis. And while the manic episodes of bipolar 1 disorder can be severe and dangerous, individuals with bipolar 2 disorder can be depressed for longer periods, which cause significant impairment. And although bipolar disorder can occur at any age, typically it's diagnosed in kind of late adolescence or the early 20s, and symptoms can vary from person to person and also vary over time. So, what is mania and hypomania? Well, these are two distinct types of episodes, but they have the same symptoms. So, mania is the more severe form as opposed to hypomania and causes more noticeable problems at work, at school, social activities, and relationship issues. Mania may also trigger a break from from reality, which we call psychosis, and require hospitalization, a higher level of care. So both a manic and hypomanic episode include three or more of the following symptoms. So number one, abnormally upbeat, jumpy, or wired. Number two, increased activity, energy, or agitation. Number three, exaggerated sense of well-being and self-confidence, which we call euphoria. Number four, decreased need for sleep, so less sleep. Number five, unusual talkativeness, pressured speech. Number six, racing thoughts or distractibility. Number seven, um, poor decision making, for example, going on buying sprees, being very impulsive, taking sexual risks, or making foolish investments. So you have to have three or more of these symptoms to meet the diagnostic criteria for a manic or hypomanic episode. So what about major depressive episode? These include symptoms that are severe enough to cause, again, impairment in functioning in terms of your functioning in day-to-day activities such as work, school, social activities, or relationships. And an episode includes five or more of the following symptoms. So, number one, depressed mood, such as feeling sad, empty, hopeless, or tearful. And in children and teens, depressed mood can usually appear as irritability. Number two, marked loss of interest or feeling no pleasure in all or almost all activities. Number three, significant weight loss when not dieting, weight gain, or decrease or increase in appetite. So, in children, failure to gain weight as expected can be a sign of depression. Um, Number four, either insomnia or sleeping too much. Number five, either restlessness or slowed behavior. Number six, fatigue or loss of energy. Number seven, feelings of worthlessness or excessive or inappropriate guilt. Number seven, decreased ability to think or concentrate or indecisiveness. So these are what we call cognitive symptoms. And number eight, thinking about planning or attempting suicide. So suicidal thoughts, distressing, intrusive thoughts. So what about children and kind of adolescents? Well, symptoms of bipolar disorder can be really difficult to identify in children and adolescents. It's often hard to tell whether these are kind of the normal ups and downs, the results of stress or trauma, or signs of a mental health problem other than bipolar disorder. Children and teenagers may have distinct major depressive or manic or hypomanic episodes, but the pattern can vary from that of adults with bipolar disorder, and moods can rapidly shift during episodes. And some children may have periods with mood symptoms between episodes. The most prominent signs of bipolar disorder in children and teenagers may include severe mood swings that are different from the usual mood swings. Okay, so that's kind of a very um, basic description of bipolar disorder, different types, bipolar 1, bipolar 2, and major depressive disorder. So what about treatment? Well, alhamdulillah, we have excellent treatments for bipolar disorder. And there's been a lot of movies depicting patients with bipolar disorder. So, in terms of treatments, the real aim or goal of treating bipolar disorder is to reduce the severity and number of episodes of depression and mania to allow as normal a life as possible. So, what are the options for bipolar disorder? Well, if a person is not treated, episodes of bipolar related mania can last for between 3 and 6 months. Episodes of depression tend to last longer, often 6 months to up to a year, but with effective treatment, episodes usually improve. Most individuals with bipolar disorder can be treated using a combination of medication um, and psychological therapy. So these can include one or more of the following: medicines to prevent episodes of mania and depression. These are known as mood stabilizers, and you take them every day on a long-term basis. We can also treat with medication to treat the main symptoms of depression and mania when they happen. Learning to recognize the triggers and signs of an episode of depression or mania is really important. So, early kind of relapse prevention, psychological therapies or psychotherapy, such as talking therapies, which help you deal with depression and provide advice on how to improve relationships, and lifestyle advice. So, doing regular exercise, which releases endorphins, which stabilize and improve mood, planning activities you enjoy to give you a sense of achievement, and advice on improving your diet and getting more sleep. Most people with bipolar disorder can receive most of their treatment without having to be hospitalized, but in certain patients, treatment by hospitalization may be required if the symptoms are severe, and you may have to be sectioned under the Mental Health Act if you're living in the UK, as there can be a danger that you may hurt yourself or other people. Okay, so what about medications for bipolar disorder? Well, we have several medication options that basically have the objective of stabilizing mood. Um, and these are commonly called mood stabilizers. They include lithium, anticonvulsant medications, which are basically medications used to treat epilepsy, and antipsychotic medications. Okay, so what about lithium? Well, in the UK, lithium is the primary kind of gold standard medication that we use to treat bipolar disorder. Unfortunately, it is a long-term treatment for episodes of mania and depression, and it's usually prescribed for at least a minimum of 6 months. If you are prescribed lithium, you have to stick to your prescribed dose and do not stop taking it suddenly unless you get medical advice. And for lithium to be effective, the dosage must be correct. If it's incorrect, you may get side effects such as diarrhea and nausea. Okay. The other thing with lithium is that you have to have regular blood tests at least every 3 months to make sure that your lithium levels are within the therapeutic window. So if the lithium level is too low, it's not going to be effective in treating your bipolar disorder. And if it's too high, it can be toxic. So lithium, it can be toxic in higher doses. Your kidney and thyroid function also need to be checked, usually every 6 months. When patients are taking lithium, we advise them to not use non-steroidal anti-inflammatory drugs such as ibuprofen unless they're prescribed by the GP. And in the UK, lithium and the antipsychotic medication aripiprazole are currently medicines that are officially approved for use in teenagers with bipolar disorder. But the Royal College of Pediatrics and Child Health says that the other bipolar medications may be prescribed for children if recommended by their doctor. Okay, so that's lithium. The second type of medication we have available are anticonvulsant medicines. These are normally used to treat epilepsy, and they include sodium valproate, carbamazepine, and lamotrigine. These medicines are sometimes used to treat episodes of mania, and they're also referred to as long-term mood stabilizers. Like I mentioned, they primarily used to treat epilepsy, but they also have been found to be effective in treating bipolar disorder. A single anticonvulsant medicine may be used, or they may be used in combination with lithium when bipolar disorder does not respond to lithium on its own. Okay. We also have sodium valproate. This is not usually prescribed for women of childbearing age because there's a risk of physical defects in babies, such as spina bifida, heart abnormalities, and cleft lip. There may be an increased risk of developmental problems such as lower intellectual abilities, speech problems, memory issues, autism, spectrum disorders, and delayed walking and talking. In women, your GP may decide to use valproate if there's no alternative or you've been assessed and it's unlikely you'll respond to other treatments. Okay. Um, and the GP will also need to check that you're using a reliable contraceptive and will advise you on the risk of taking medication during pregnancy. Carbamazepine is usually only prescribed on the advice of an expert in bipolar disorder, i.e., a psychiatrist like myself. And to begin with, the dose will be low and then it will be gradually tapered up to a therapeutic dose. We monitor progress very carefully, especially if for women who may be taking contraceptives. We do regular blood tests on your kidneys and liver to make sure there's no issue, no side effects. And you also need to have regular blood count tests as you may have and also have your weight and height measured. Lamotrigine, this is also another medication we have available. Again, you start on a low dose and you taper up to therapeutic dose. So those are the anticonvulsant medications. Just to summarize, so we've got lithium, which is the gold standard. Then we have anticonvulsant medications. And then finally, we have antipsychotic medications, which are also an option that we can use. And sometimes they have to be used to treat episodes of mania. And common antipsychotics we may use include haloperidol, olanzapine, quetiapine, and risperidone. They can also be used for long-term mood stabilization. Quetiapine has good evidence to be used for long-term bipolar depression. As antipsychotics cause side effects such as blurred vision, extrapyramidal symptoms like stiffness, dry mouth, constipation, weight gain, the initial dose will usually be low. Um, and if you are prescribed antipsychotic medication, you need to have regular health checks at least every 3 months, but possibly more often, particularly if you're diabetic. If your symptoms do not improve, you may be offered lithium or valproate as well. There's something called rapid cycling. So basically, this is where you have rapid cycling of moods, and you'll be prescribed a mood stabilizer or a combination of mood stabilizers if you experience this, where you quickly change from highs to lows without a normal period in between. So normally you would have a high period of a high mood or euphoria, then a break, and then low mood. So rapid cycling is where there's basically no gap between the highs and lows. Okay, you will not usually be prescribed antidepressants because this can actually trigger a bipolar episode. Another important aspect of treatment is learning to recognize triggers. So if you do have bipolar disorder, you can learn to recognize the warning signs of an approaching episode of mania or depression. And this is also, we involve families in this. A community mental health worker, such as a psychiatric nurse, may be able to help you identify the early signs of relapse from your history. This will not actually prevent the episode occurring, but it will allow you to get help in time. And it may mean making some changes to your treatment, perhaps by adding an antidepressant or an antipsychotic medication to the mood stabilizer you're already taking. Okay, what about psychological therapies? Well, some people do find psychological treatment helpful when used alongside medication. in between episodes of mania depression, because when somebody's severely depressed or manic, hypomanic or manic, they usually can't access or benefit from psychological therapies. So these include psychoeducation. So we teach people, educate them more about bipolar disorder, cognitive behavioral therapy, which is most useful for treating depression, family therapy, which is basically a type of talking therapy that focuses on family relationships, such as marriage, and encourages everyone within the family relationship to work together to improve mental health. So, what about pregnancy and bipolar disorders? I touched on this slightly earlier on. So, one of the main problems is that the risks of taking bipolar medication during pregnancy are not that well understood. So if you are thinking about getting pregnant, it's important to talk to your GP or mental health team about taking bipolar medication during pregnancy. And it's basically weighing up the pros and cons. They're weighing up kind of what are the advantages of taking medication against the side effects in terms of risks to the pregnancy. And similarly, the risks of not treating a bipolar episode in terms of deterioration in mental health, which in turn can also harm the baby. So if you're pregnant and you do have a bipolar disorder, you have a written plan for your treatment, which should be developed as soon as possible. The plan should be drawn up with you, your partner, your obstetrician, midwife, GP, and health visitor. Some medications such as valproate are not routinely prescribed for pregnant women because they may harm the baby. If you do become pregnant while taking medication, then that's been prescribed for bipolar disorder. It's important that you don't suddenly stop it without medical intervention. And if bipolar medicine is prescribed for bipolar disorder after the baby is born, it may also be affect your decision whether or not to breastfeed. Okay, so that's a summary of the medication. Subhanallah, patients with bipolar disorder, it can be very debilitating. Actually, it's interesting. A lot of kind of celebrities, they go through these manic, hypermanic episodes, and artists, and they find that they're more creative. So actually, it can, in certain aspects of their life, improve their functioning, but overall it's detrimental and harmful. So patients who become hypomanic or manic, they may behave recklessly in terms of, getting into debt because they're spending recklessly, driving recklessly, not sleeping, even risk of harming themselves because they can go into a delusion where they feel they've got special powers, and it's quite risky in terms of if it's not treated. So it's really important for all of you to understand what is bipolar disorder, what are the different kind of mood issues that can occur. And again, as I've mentioned in all my previous videos, early intervention, that's really, if you don't take anything away from my video today, it's really to emphasize that early intervention, seeking help as early as possible is really important to kind of not allow stigma to prevent you accessing expert treatment, because as with all mental health illnesses, the longer you leave the illness untreated, the poorer the prognosis. Inshallah, that was helpful. Please do put any feedback in the comment section, and if you need any other education on particular specific mental illnesses and treatments, let me know, inshallah. Otherwise, until next time, this is your brother, Dr. Abu Isa. Assalamu alaikum wa rahmatullahi wa barakatuh.